All right, let's get right into it. Today, we're tackling a really critical and complex knee injury, the tibial plateau fracture. So what happens when the very top of your shin bone, the part that holds you up, actually breaks? Now, you might look at this and think, only 1% of all fractures. What's the big deal? Well, don't let that small number fool you. Because of where it happens, right inside the main knee joint, this is an injury that can seriously impact how you move for the rest of your life. So to really get why this is such a major injury, we need to talk about what's actually breaking. What part of the knee are we even talking about here? We're talking about something called the tibial pleateu. The easiest way to picture it is as the landing platform at the very top of your shin bone. It's this flat surface that supports your entire body weight with every single step you take, and it's covered in this super smooth cartilage that lets your knee bend without a hitch. And what's really fascinating is how people get this injury. You've got two completely different stories that end in the same place. On one hand, you have younger folks, usually men, who get into a high-energy accident, like a car crash or a bad sports injury. But on the other hand, you have older patients, often women with weaker bones, where a simple fall from standing can be enough to cause the exact same fracture. And here's the point you absolutely have to understand. This is so much more than just a broken bone. Because when that plateau breaks, it often takes everything else with it. The ligaments that keep your knee stable, the meniscus that acts as a cushion, it's really an injury to the entire joint. So, because it's so complex, doctors need a consistent way to figure out what they're dealing with. Which brings us to classifying the damage. How do they answer the question, how bad is it really? Well, first things first, they've got to do a thorough workup. That means a physical exam where they're carefully checking for any nerve or blood vessel damage. They're also on high alert for something called compartment syndrome. That's a super dangerous pressure buildup that is a true surgical emergency. And while x-rays give them the first look, a CT scan is almost always the next step to get that detailed 3D picture they need to plan a surgery. Now, to make sure every surgeon is speaking the same language, they use a system to describe the break. You can almost think of it like they're giving the fracture a personality profile, which helps everyone understand exactly what they're up against. And that personality is really all about the specific pattern of the break. Is it a nice clean split? Did a piece get pushed down into the bone? Or did the whole thing just explode into a bunch of pieces? These diagrams kind of give you an idea of the different types they're looking for. And this is the official system they use. It's called the Schatzker classification. It runs on a scale from 1 to 6. A type I is a pretty simple split, but as you go up the scale, it gets more and more complex, all the way to a type V. And that's where the entire joint surface has shattered and completely separated from the rest of the shin bone. The higher the number, the bigger the challenge. So once the damage is classified, you get to maybe the single biggest question for the patient. What are we going to do about it? And this is it, the million-dollar question. Do we need to operate, or can we manage this without surgery? Really, it all boils down to one word, stability. See, if the broken pieces are still lined up pretty well and the joint surface hasn't caved in, a non-surgical approach with a brace might do the trick. But the moment those pieces are shifted apart or the joint surface is depressed, surgery is almost always needed to rebuild that smooth, stable platform. And, of course, it can get even more complicated, right? Think about an older patient with weaker bones. In those cases, surgeons follow a very clear, logical pathway, kind of like this flowchart here. It helps them weigh everything, the patient's health, the hospital's resources, the exact type of break, to figure out the absolute best plan for that individual. Okay, so let's say surgery is the answer. What does that actually look like? Let's dive into the main techniques that surgeons use to put that knee back together. So, there are a few big players in the toolkit. You've got ORIF, which is the classic open surgery with plates and screws. Then there's ARIF, a much less invasive way to do it, using a tiny camera to see inside the joint. Sometimes an external frame is used to hold all the pieces steady from the outside. And finally, for certain patients, they might go straight to a total knee replacement, or TKA. And this is a perfect example of when that last option, the TKA, is the right call. Look at this. For this patient who already had some pretty bad arthritis, just fixing the broken bone wouldn't solve the underlying problem. A total knee replacement at the same time as the injury, that's a single surgery that takes care of both the fracture and the arthritis. One and done. But getting the bone fixed is really only half the battle. The road back to walking, running, and just living your life, well, that's a whole other journey. Recovery pretty much rests on two pillars. First, early movement. It is absolutely critical to get that knee bending again to prevent it from getting stiff. The goal is usually to hit a 90-degree bend within the first month. And the second pillar, and this is the hard part, is patience. You cannot put weight on that leg, sometimes for as long as 3 months, to give that delicate cartilage a chance to heal properly. And of course, for any active person, the number one question on their mind is probably this: am I ever going to get back to the sports and activities that I love? Well, the data here actually offers some serious hope. For patients who are treated with that minimally invasive camera-assisted technique, check this out. An incredible 83% are able to get back to playing sports. And this chart just lays it all out, doesn't it? The connection is crystal clear. The less invasive the surgery, the better your chances of getting back in the game. That camera-assisted surgery, RFI, has a remarkable 83% success rate, which is way ahead of the more traditional open approaches. It's a powerful piece of data that shows just how much the surgical technique can impact your future. But, and this is a big but, even with a perfect surgery and a full return to sports, there is a long-term risk that just can't be ignored. The tough reality is that about half of all patients who have this injury will eventually develop arthritis in that knee. And that really gets to the heart of the matter, doesn't it? Getting the bone to heal is one thing, but the real challenge is protecting the health of the joint for the next 10, 20, 30 years. It's a powerful reminder that an injury to the joint surface can cast a very long shadow, one that can last a lifetime.